Okay, this is starting part 2 of intraoral anatomy on the radiograph. And we looked at the maxillary anteriors before, and pretty much all of that anatomy was on the maxillary central or midline shot. You'll see different pieces of that as you kind of work your way back. But then the only other thing you pick up in the premolar area is the maxillary sinuses, which continue on to your molars. So you'll see this fine, very delicate, almost lacy-like radiopaque line. That is either the floor of or the septum or the wall of the maxillary sinus. So make sure when you're reading a question, if it's a verbal question, is it asking you for the floor or septum or wall? Because that particular item is going to be radiopaque. Or is it asking you for the body of the maxillary sinus? The body of the maxillary sinus is the actual space, so it's going to be radiolucent. A little further back, you have the cross-section of the zygomatic arch. That is a very bold, heavy radiopaque line. It's more radiopaque and it's wider. So make sure you can see the difference between the sinuses here and the zygomatic arch here. And the zygomatic arch is just the cheekbone. Okay, you've also got your maxillary tuberosity. And then one of my favorite questions, the Danby likes to ask this question, the Dental Hygiene National Board likes to ask this question, but the question is, what is the only mandibular anatomical landmark that you might see on a maxillary periapical? Well, if you have your vertical angulation correctly, you shouldn't see anything mandibular on a maxillary periapical. But depending on how you have the patient biting for a maxillary molar shot, you might pick up the very edge corner of the coronoid process right in the bottom posterior side of that image. So if you ever see that question, what mandibular anatomic landmark could be present on a maxillary periapical, that's going to be your only possible answer, assuming your angulation is correct. Okay, so we're going to scoot on down to the third page. And on the third page, let me shrink this just a little to make it fit. Okay, on the third page, we start with the mandibular landmarks. And so what you're looking at here is if you've taken a mandible off of the skull and you're looking at the lingual surface. So this is the lingual surface of the teeth and this is the lingual surface of the actual mandible itself. In the very center on the lingual surface, you have two different structures. One of them is, and that's the genial tubercles, they're little bumps of bone that different tendons and ligaments attach to. So since they're extra bone, they're going to be radiopaque. And on a radiograph, they almost look like a little radiopaque donut. Okay. The second structure in that same area is actually the lingual foramen. Now, since it's a foramen, it's obviously going to be radiolucent. It's going to be dark. So if you think about the radiopaque donut being the genial tubercles, the hole in the donut, the center of the donut where the hole is your lingual foramen. So if you have a question that's asking you about this area and the area is just kind of pointing to the center, look and see if it's asking you for a radiopaque or a radiolucent landmark, because they are in the same place. Genial tubercles are radiopaque because they're extra bone. The lingual foramen is radiolucent because it's a foramen. Another structure that you have present here is the mental ridge. That is just the angle of your image. So you have a negative angle creating this image, and if your vertical angle is just right coming in, it can catch the chin all the way up. So you're getting that cortical bone of the chin all the way up to the teeth, and it creates a little more radiopaque area here. The more prominent the person's chin is, the more likely you are to have the mental ridge, or the more prominent it's going to be in the image. You've also got the inferior border of the mandible here. Again, it's that lamina dura bone. You've got all this trabeculation, all this pattern to the bone up here. This is the edge, and the edge of the bone is always going to be smooth and very solid. Very often, depending on your vertical angle, you're also going to have this radiolucent edge here at the bottom. What you're looking at there, you've got the teeth up here. This is all the mandible. If this is the inferior border of the mandible here, then this radiolucency here at the very bottom is actually the floor of the mouth. It's the soft tissue of the floor of the mouth. Okay, I'll slide this up a little more to get it in the center. So again, most of the anatomy happens in the midline, the center part of the anterior. But as you go a little further back on the mandible, again, you've got the same trabecular pattern, and it is as identifiable as fingerprints. Everybody has their own trabecular pattern, so you can kind of look at different images and just see the consistencies of that in your patients. But as you get back to the second premolar area, you'll have your mental foramen, which is on the buccal side of the bone, on the buccal side of the mandible here, and it is one end of the mandibular canal. So the mental foramen shows up here at about the second premolar, and then you can actually see the canal. The canal itself is radiolucent, and the walls of it are radiopaque. So it's going to look like a straw. You're going to see the edges, but then the empty space that's actually filled with soft tissue is going to be radiolucent. The actual physical part of the straw, the walls of that canal are going to be radiopaque. Now, the mandibular canal runs all the way up and posterior to the mandibular foramen. Now, the mandibular foramen is not going to be visible on an intraoral image. That's kind of a tricky question. So it may ask you, and you're going to have to read really carefully. The mental foramen is at the second premolar area on the mandible. The mental foramen. But the mandibular foramen is not visible on an intraoral image. It is visible on panoramics, but not on intraoral images. Okay, then we'll scroll on down a little bit more to the molar area where we pick up a little more anatomy. Again, your mandibular canal just kind of continues along the bottom, and depending on how far back your sensor or your film is placed, you'll see it start to curve up, because as it goes further back, it does curve up the mandible. And then you're actually going to see that external oblique ridge, which is on the buccal part of the mandible bone itself. If you look at a skull or a mandible, you'll see that external oblique ridge. It's a little overlap, a little extra piece, and so that's going to be radiopaque. The external oblique ridge comes across at about the CEJ, and it kind of looks like a radiopaque shadow. And then sometimes you see also the same thing, that little radiopaque shadow running right along the apex of those molars, and that's the internal oblique. The internal oblique ridge is this line here. Okay, so if it's at the CEJ, it is the external oblique, but if it's at the apex area of the teeth, then it is actually the internal oblique ridge. And now we're going to look at some panoramics and how the anatomy presents itself on a panoramic. So let me get this adjusted. There we go. So on a panoramic, you've got a lot of the same anatomy. It looks a little bit differently just because the picture is a little different. But if you're looking at a panoramic, and I'll kind of go through each of these, you've got your maxillary sinus, just kind of runs along. This is all actually maxillary sinus here. So you've got different lobes or different sections, and each of those has a wall and floor and just different parts that would be radiopaque, and each one has a body that would be radiolucent. Okay, so those are your floor of the sinus and your maxillary sinus. The nasal septum is here. Your nasal fossa, remember, on either side of your nasal septum. When we looked at earlier that XY formation, this is the XY formation. You have your nasal fossa, you've got this bony section that separates your nasal fossa from your maxillary sinus. So that's kind of what that was showing you there. The coronoid process here, and then this is the condyle. You've got your zygomatic arch, and this looks more like it does in an actual skull. The intraoral image catches a cross section of it and it distorts it a little bit because of that really steep vertical angle that we typically have. The mandibular canal is right here. It runs on both sides. You've got your mental foramen at about the second premolar, and your mandibular foramen is way back here. So I'll show you, it's on the other side. It is visible in a panoramic, but look how far back that is. That's not going to be visible on an intraoral image. And then this is actually your external oblique, that little radiopaque shadow coming across right there at the CEJ. You've got the inferior border of the mandible here, but if you look, that cortical plate or the cortical part of the bone actually outlines every single part. And that's kind of what it does. That's its point. Okay. Then we'll scroll down to this other image. And what you're looking at here is the glenoid fossa. The glenoid fossa is kind of the cup part that the condyle sits in to create that TMJ joint. You've got your hard palate that runs across. And you have to be careful. I'm going to do another recording where we talk about positioning the patient. Obviously, for these diagrams, the patient was positioned perfectly. But what you're looking at with that hard palate is it is above the maxillary tooth apex for each of your teeth for the most part. Depending on the placement and the position of the patient, that can actually overlap a lot of your teeth and really interfere with the image. Your maxillary tuberosity is going to be on either side of that distal molar. There's your condyle. That was your coronoid process. That's your condyle. So that's your glenoid fossa on the other side. And then this is your external oblique ridge because it comes across at the CEJ. I showed you that on the other image, but that's your external oblique at the CEJ, and you can't see it, but if you did, remember the internal oblique would come right across at the apex. And then again, here's your mandibular canal.